Hello everyone and welcome back. This series is targeted to patients who have chronic care conditions such as diabetes and the healthcare professionals taking care of them to be able to navigate through the difficult financial times that we are going through right now. The last time I told you I'm going to divide the videos by healthcare coverage, meaning what to do in cases of no healthcare coverage or suboptimal healthcare coverage or Medicare, Medicaid, and so on. Today we're going to talk about what to do if you don't have any healthcare coverage and no insurance, but yet have a chronic healthcare condition such as diabetes, how to navigate this. Now, the first thing we need to talk about is the visits. It is very tempting to say, I'm not going to go for my office visits in order to save money because I don't have the money right now to pay for a copay or for a physician because these healthcare visits can be very expensive. One thing that healthcare professionals don't understand very well is that the payment structure is mainly based in the United States on employer type of healthcare coverage, meaning somebody who works, has a job, has their employer covering their healthcare. And in those cases, still healthcare can be very expensive, but in cases where there is no healthcare coverage from an employer, things can be not just expensive, but insanely expensive. Even a visit, an office visit, can be very expensive. So it is very tempting to say, well, I'm not going to go for that visit. My advice is not to do that, but to maintain healthcare as an outpatient visit, especially with your primary care physician. And the reason for this, because if you forego the regular visits with your primary care physician, what ends up happening is you can get into severe healthcare issues and situations, not to mention their impact on your health and what problems you would have going forwards, but also that you can get into emergencies like very high glucose levels, diabetic ketoacidosis, hyperosmolar non-ketotic state, things that would end up causing you to go to the hospital or to the emergency room and causing an admission. Now, the price of office visits is as high as it is nothing compared to the price of an admission, especially an admission in the intensive care unit, where a few days of admission can drag up financial debt or expenses more than tens of thousands of dollars. So we need to avoid those situations. Now, if you end up in those situations, by the way, there are ways that can help. But the best advice I can give you is to try and not end up in those situations, or minimize the chances, at least, of ending in those situations in the first place. And one of the ways is to go to the primary care physician, and if you have like a specialist, to go to the specialist as well, but you can limit the number of times per year that you go. That is perfectly fine, but do not forego this altogether. Now, you may ask me, but I cannot afford it. Like those visits are very expensive, and my share of them even is very expensive. How do I keep on going to my doctor if the price is that expensive? And the answer is that there are some places, or multiple actually, healthcare institutions that are not for profit. Now, the good thing about those not for profit healthcare institutions is they always have some form of a program that is called either a charity program or patient assistance program. Those programs are designed to help patients who have no coverage whatsoever. So the key here is to do your research and understand what kind of program that non-for-profit institution has, and to apply for that coverage. Now, if you don't have any healthcare coverage, and you don't have any like high income, then it will be not, I won't say easy, but it is very, very possible and likely that you would get even 100% coverage. And that those 100% coverage would typically cover the cost of the visit, as well as the cost of the testing that you would get done in that institution, whether it be a lab test or a x-ray or of some sort. All right, radiology testing. Now, you need to be careful, of course, and know before you go for any testing what is covered, what is not, and make sure that you have this approval from that healthcare institution for that patient assistance program or for that charity program, so that you are you know what you can do and what you can afford and what you cannot afford. But one of the hassles of this program is that you have to apply every single time. So if you go for a visit, you have to do an application. Now, if you're like me who hate paperwork, I know that can sound annoying because you have to do the application. Usually it involves a lot of data about you, but also would require W-2 form or some form of a financial statement to explain that you're not able to afford the visits and that you don't have like a major income that would allow you to pay towards the visits. And then you can get that discount approved up to 100%. Depending on the case, that will allow you to maintain your visits and still, not pay for them. Now, the annoyance of having to apply for paperwork every single time is little annoyance in comparison to the great benefit of getting your healthcare basically for free in terms of the visits and in terms of radiology, labs, testing, and so forth. Notice another thing about those types of programs is that they usually have two separate types of assistance programs. One is for the outpatient setting and one is for the inpatient setting. So if you are dealing with physicians' offices, labs and radiology and so forth, then you can get an approval for that, but that doesn't automatically extend to the inpatient or if you're admitted to the hospital. So you need, in those cases where you're receiving two types of care, one for an admission in the hospital and then follow up in an office visit, you need to apply for both sides of it. And every single time that you go for that visit, you would need to typically do the application. But of course, the good thing about it is that if it works out and you are covered for those expenses, the paperwork that you have to do every time is the same. And so it becomes much easier with time, even if you don't like doing like a lot of paperwork and routine work. I personally hate it, but I would definitely do it in order to save a lot of money that I wouldn't have to pay. All right, so that's visits and that's testing. I want all the healthcare professionals to understand that and to understand that this is available for patients to have their front care, front desk also aware of this, because it is a team effort to take care of patients, especially patients with chronic diseases. And when you feel or sense that your patient is having financial difficulties, you need to be sensitive to that. You need to offer those patient assistance programs, explain how they work, explain that the patient has to do it. And for both healthcare professionals and for patients, this is not something that, they are doing, that those institutions are doing for completely for free, that they are suffering, a lot of losses on those things. No, that the design of a non-profit organization includes those situations where they have to care for a lot of uninsured patients, and in return for that, their corporate taxes are basically removed. So they are in a place where they don't pay corporate taxes because they are able to provide a lot of assistance to the communities. And those are huge expenses that they would otherwise have to pay if they didn't have these programs. So these programs are there for a reason. They are there for those times that we are going through right now, where people are not able to get their health care covered. Now, this does not, of course, extend to medications and supplies, but I will make a separate video to say, if you don't have any healthcare coverage, how can you get your diabetes supplies? How can you get your medications and not pay a tremendous amount of money for them? And until next time, stay tuned and stay healthy.